Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? Happy Thanksgiving. I know I'm a day too early, but I am not going to do a podcast for you on Thanksgiving. I'm going to spend it with my family, with my parents, with my siblings, with my wife, with my daughter. I'm not going to be here on Thanksgiving. I won't be here on Thanksgiving, and I won't be here on Christmas. Those are the 2 days of the year that I can, for the most part, guarantee you that I will not be here in the office at my company, at Christian Brindle Insurance Services, and I won't be doing a podcast for you. I'm just not going to do it, folks. I mean, those are my 2 days. I work on my birthday most years. I guess you could make the argument that in the past I've taken off on this podcast to do, when the days overlap. But usually I work on my birthday. I think every year I've been in business, I've worked on my birthday, except for one. Maybe two. I'm drinking my coffee. What's left of it, I suppose. But I wanted to quickly express my gratitude to every single person that listens to this podcast, that has listened to the podcast. Even if you just listen to one episode, thank you, thank you, thank you, thank you, thank you. I never, ever, ever imagined we'd get as an audience the size we have. I never imagined we'd get as many downloads and listens that we have. We're well into over 20,000 downloads on the audio version by itself. That doesn't include YouTube. YouTube probably brings another couple of thousand, and we have only been doing YouTube probably about 4 or 5 months at this point, doing the podcast on video. So thank you so much to every single person that listens, and every single person that has had faith in me and my organization from listening to the podcast, that contacted us since we started to let us work with you on your plan. Every single person that's become a client of mine from listening to this podcast, thank you so much for putting your trust in me. Thank you for your business. I appreciate you. I hope you have a lovely and wonderful and blessed holiday with family. I hope it's wonderful. I hope it's everything you can think of. I hope you eat an unbelievable amount of food, and I hope you have a great, great day. Whatever it is that you do in your household. My household's pretty traditional. I mean, it's pretty easy to kind of see what we do. We all get together. So in my family, there's my mom, my dad. My dad, as many of you know, and I did an interview with my dad earlier in the year before my daughter was born. My dad, Bob Brindle, is a Medicare specialist. And he's basically been a Medicare specialist since the late 80s, early 90s here in Utah. He kind of pioneered the industry pretty significantly here locally in Utah. He was one of the first people to do it full-time and be a specialist, and back then there were hardly anybody doing it, and he was one of the first. Not that he was the first, but he was one of the first, one of the original people, and he pioneered a lot of the way, and I grew up around the business because I grew up in a household where my dad worked on this. He's been doing this long before I was born. And I'm appreciative of my dad, and very much, because he's been a great teacher, a great mentor for me. When I first got started, he just helped me out so much as far as teaching me how to do the business. The knowledge that he gave me was what helped me out the most. I can't stress that enough, to kind of help me be who I am today and put me in a position to help my clients in a way that I probably never would have been able to do without his guidance. I'm very, very appreciative and thankful for my dad. But on Thanksgiving, my mom and dad, we get together. I have 2 older brothers. we get together. My two older brothers both have serious girlfriends. They're probably going to be at Thanksgiving. My wife will be there, and this will be our daughter's first Thanksgiving. So we kind of all get together. It's a little bit of crammed, packed house now, especially because all of the kids, me and my brothers, have women in our lives. I've been married for several years, but now it's just kind of a big group. But we always get together and we always have a good time. I'm not particularly close with my siblings. I probably shouldn't say that on here, but I'm not. I mean, but it's nice to see them, but we're just not that close. I don't have any bad feelings towards them or anything like that. We're just not close. We're not very close. We're all very close to my parents, and that kind of holds us all together. But we always have a good time. Well, most of the time, as much as you can. Families come with good and bad, right? We all know that. But today, to kind of show my appreciation to you, my audience, I'm going to read you one chapter, the first chapter of my book, Medicare Guidance, Picking the Plan for You. And I think it's very, very fitting because I hear, not that much, really, but I hear people very often complain about our system and our insurance in the insurance industry and the Medicare system here in the country. And in the first chapter of my book, I talk about Medicare. If you've purchased the book online, thank you so much for your support. So you might already have read the book yourself. Any person that's a client of mine, I always offer to send you a free copy, free of charge, as a personal gift from me. So a lot of you might have already read this chapter, but if you haven't, I'm going to go through it, and I think it's very fitting because I hear a lot of people complain about the insurance industry. Not that many. I think I probably have more people that enjoy the way the Medicare system works than people that don't, but I hear a lot of people complain about it. And in that chapter, I kind of go over what the insurance industry for seniors looked like before Medicare existed. It's very, very fitting, and I think a lot of people are probably very appreciative and thankful for the Medicare plans they have if it was set up correctly and if they have the best thing for them. They're probably in a great situation to where they have better health care, better insurance than really anybody else, right? I mean, people on Medicare have better insurance than people under 65, better than me, better than a lot of people. Now, there's probably exceptions to that where people have fantastic group plans or they have retirement plans or whatever the case might be, but people on Medicare really have pretty good coverage, pretty fantastic coverage, no matter what you have, right? I'm under the impression of that. I'm a big advocate for it. I think it's great. But for the people that complain about it, I think it's a good idea to put it into perspective what the insurance industry looked like for seniors, retirees, people that would have been on Medicare, quote unquote, before Medicare even came into the equation. And I touch base on this in the first chapter. So I'm going to read it for you, but after I take a break. And after we hear from our sponsors this week. Don't go anywhere. I'm going to go through the first chapter. This is my way of showing appreciation, completely free. It's a great book. I've written 2 books on the topic of Medicare. This, in my opinion, is the best one I've written. It's the most interesting one, and there's a chapter on everything you need to know about Medicare. I try to make it as interesting, as fun as I can, same way we do on the podcast. And I'm going to go read you the first chapter as a thank you to show my appreciation to you, my audience, in honor of Thanksgiving. Don't go anywhere. I'll be right back.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody. Thanks for sticking with me through our sponsorship breaks. Okay, so as promised, I told you I was going to read you the first chapter of my book, the best book I've written. I've written 2 books on the topic of Medicare. I'm working on my 3rd book that's not necessarily about Medicare, but it's about insurance. It's called The Insurance Funnel. It will come out before the end of the year, I promise. I've kind of been slowed on being able to work on it due to the fact of the enrollment period. And it's been the craziest enrollment period I've ever been through, personally. I did an episode about why I thought that this enrollment period probably had more changes than any ever, except with the exception of the first one, when in 2005-06, when Medicare Advantage and Part D plans came into the equation under the Bush administration, because before that, there was no Part D, there was no Medicare Advantage. So obviously, I would say that one is the exception, but other than that, I'd say that this has probably been the busiest, most chaotic enrollment period ever due to all the changes taking place. And I kind of highlighted that in that episode. But I will have that book out by the end of the year, I promise. But, as promised, I'm going to read you Chapter 1 of my book. Now, this is going to be kind of weird for me because I'm going to be reading my own words. Chapter 1, Medicare Intro. To make the best decision regarding Medicare, one must first understand Medicare. Ask yourself the question, what is it? You might have a rough idea of what Medicare is, but do you really know its history? Medicare was first put into place in 1966 under the presidency of Lyndon B. Johnson. Essentially, it is a single-payer service provided by the United States government for its citizens who qualify. As of 2015, it was reported that Medicare provided benefits to an estimated 55 million people nationwide. Before Medicare was created, around 60% of individuals over the age of 65 had health insurance, leaving roughly 40% without. This was due to the prices being unaffordable for a large portion of the senior population, as the prices often tripled for someone over 65 compared to a younger person. This was clearly a problem. I am in no way suggesting that Medicare is perfect, because it certainly is not, in my opinion. That being said, I think most of us can agree that it is an upgrade on how things were beforehand. The system has its faults, but it is the best one we have been able to come up with up until this point. My job is to teach you how to find the right plan for you. Medicare has gone through some changes since 1966. Plan types have been added, changed, and taken away. Today, we have a few different options we can travel down when we're choosing our plans, which I will touch on more in later chapters. For someone to qualify for Medicare, they must meet a few conditions. Number 1, you must be an American citizen. Number 2, you must have worked in the U.S. for at least 10 years of your life to obtain the proper credits. Most folks have. There are exceptions to these rules, however. If someone is on Social Security disability for 24 months consecutively, they will be placed on Medicare automatically by Social Security. Medicare has 2 parts that are provided from the government. They have nothing to do with any insurance company or any broker. These 2 parts can only be obtained from Medicare directly. They are as follows. Number 1, Medicare Part A. Number 2, Medicare Part B. Medicare Part A is coverage in the hospital room, the hospital bed, practically anything that has to do with the physical hospital building itself. It does not cover the doctors who are treating you, any drugs they are giving you, the IV if needed, etc. Part A covers other services as well. It will also cover hospice care and skilled nursing, rehab centers, as an example. If the individual has met the necessary working requirements that were explained earlier, Medicare Part A has no monthly premium/payment to obtain the coverage. The reason the government requires someone to work at least 10 years of their life is because when you work for an employer, the employer takes taxes out of your paycheck automatically and pays them to the government. Part of these taxes are for Medicare and Social Security, also known as FICA. So if you think about it, you have been paying for Medicare all of your life that you've been working. If you have not met the working credentials, Medicare has you pay a monthly premium for your Medicare Part A. This varies on the situation. Medicare Part B covers what is known as medical expenses. They cover the doctors themselves, outpatient procedures, having a same-day procedure without spending any time in the hospital overnight. They also cover things such as durable medical equipment, wheelchairs, oxygen tanks, etc. Unlike Part A, Part B does have a monthly premium that is determined by Medicare. It is universally the same price for everyone. However, some circumstances can cause the price to vary. In 2019, when this book was published, the Medicare Part B price will be $135.50 per month. This book was actually published in 2015, I think, or 16, but we've gone through and edited some of the premiums just to make it more up to date. But it has 2019 premiums in it at the time. 2020 rates will be different. Okay, just FYI, off the record. This price can be raised, but if it is raised for one person, it is equally raised for all Medicare beneficiaries. One instance that can cause this price to be higher than the $135.50 per month is if the individual falls into a higher tax bracket than most. They base this off of your income, what your income was 2 years prior to the current year. For example, if you received Medicare benefits in the year 2019, the income that you made during 2017 will determine if you pay more than the $135.50 per month or not. Medicare Parts A and B together provide someone with medical insurance that can assist with preventing your bills from getting out of hand. However, the coverage by itself has some rather large setbacks if that is all someone carries. Medicare Parts A and B come with rather large deductibles in the hospital, and for some services only cover 20% of the service in question. Not only that, Medicare has no out-of-pocket maximum like most insurances do. A maximum out-of-pocket is the maximum amount someone can be asked to pay during the duration of a calendar year. With most health insurances, the moment this max out-of-pocket is reached, the insurance is responsible for 100% of the medical bills. With Medicare not having a max of any kind, there is no limit to how much the person could be asked to pay out of their pocket. I have come across very few people in my career who only have Medicare Parts A and B and nothing else to go with it. And you may see why. Many folks feel it is too risky. That is why Medicare health plans exist. You may be asking yourself, how do I know what type of plan I should consider? I assure you we are getting to that. There's Chapter 1. Don't go anywhere. I'll be back after a quick word from our sponsor. I have some thoughts I wanted to share with you on Chapter 1 and kind of what you can get out of it. Don't go anywhere. I'll be right back. Welcome back, everybody! So, if you got anything out of that, that was basically just a synopsis of what Medicare is. A and B, the history, how it started in 1966, Lyndon B. Johnson put it into effect. Essentially, folks, Medicare is not perfect. Medicare has problems. There are things that can be, kind of tweaked, improved. It's gone through changes over the years, but I think what we can all agree upon, and this is something I said in the book, Chapter 1, is it's better than the way it was before. Because before 1966, before Medicare came into the equation, like I mentioned, only 60% of seniors had health insurance because the prices were unaffordable. And they could discriminate, and they could ask health questions, and they could do whatever they wanted, basically. Medicare was something where, people were guaranteed to get coverage at a certain price, at a certain age, at a reasonable price. It's not perfect, but like I said, it's the best thing we've been able to come up with so far. I hope you enjoyed that, folks. If you want more content from my book, Medicare Guidance Picking the Plan for You, I'm sorry, but you're going to have to pay for it. You can find it on Amazon for $1, Kindle version. Kindle version format's not as pretty as the paperback, unfortunately, but paperback is, I think it's $5 and some change right now. I can't remember, but when the insurance funnel comes out, I'll let you know. But the insurance funnel is going to be a much larger book, and it's probably going to cost a little bit more because there's a lot more value I'm throwing into that book. Thank you so much for listening, folks. Enjoy your Thanksgiving. I hope you have a blessed Thanksgiving, from my family to yours, from my office to yours, from my organizations to your family. Thank you for listening. I hope you enjoyed this. I just wanted to give something back to the listeners, and I thought that might be something kind of fun, because I think for most people, they're grateful for their Medicare plan. They're grateful for what it provides to them at the price it provides it to them at. And I wanted to kind of put it into perspective on what the system looked like before Medicare. BM, before Medicare, and it wasn't good. Comparing it to that, I think most people on Medicare would prefer what they have. So I think most people on Medicare that are covered well, that have the best plan for them, probably are grateful that it's there. And I hope you just don't forget to keep that in mind this Thanksgiving when you're kind of counting what you're thankful for. I'm thankful for you, my audience. Thanks so much for listening. You're fantastic. We appreciate you. I appreciate you. And I'm thankful for you. Have a great holiday. Talk with you Saturday. Take care.